Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning in to the podcast. Glad you're here. This is episode 5, and I'm going to go out on a limb and say this is the first time I've ever done a 5-part series on anything. I think this is the first time. I'm on 5. And it's about estrone. And it's a lot to unpack. And why did I do 5 episodes? Why is there so much to it? I want to tell you about estrone and me. When I first started practicing medicine, I never did just a straight, grouped up estrogen, total estrogens. It was always fractionated outward. And the reason why I always looked at estrone was because I understood metabolically that it was that final step that could cause problems. And it was important to understand estrone because it's linked to all these other downstream metabolites that can be harmful, which I'll get into a little bit more today, and which this whole series has been about. The thing is that even then, learning it in med school, 20-something years ago, there wasn't a profound amount of clinical information about this that was available to clinicians. Seriously, there was just the metabolic pathways that you learned. And then when it came to clinical application, lab work following up, nothing, very little. To this day still, there's too little. There's, when that gap happens, when Western medicine forgets about women, which it does, other people step into that space. And that's good. And it's good and bad. Let me tell you why. It's good because there's a need. And you deserve that need to be filled. You deserve a deep understanding of estrogen metabolism as it pertains to your health, your risk for breast cancer, your risk for diabetes. I mean, all the factors that it plays a role in here. Cardiovascular disease, neurological disorders. I mean, there's a lot of things that estrogen metabolism is very important to. So when that space is not being served well by the general practice of medicine that's available at your general practitioner, that opening can lead to good innovation and great ideas coming out into the marketplace. But that's not always what happens. What we tend to find happening is that you have opportunists come into the space, people who are interested in profiteer and profit mod, how much they can make in these settings. And that's what you see. And this is why I always get frustrated with boutique labs and, these fancy clinics that charge thousands of dollars to do something that should not charge nearly that much money. So I have a problem with it. But I also see the benefit of, people jumping into this space and trying to figure it out. It's just hard because I really want to protect my patients from things that are not very ethical or also not very effective. And the worst is when it's unethical and ineffective. Like you spend money on this pill that they told you to buy and it didn't do anything. Like, there's a lot of those things out there. So I'm going to go in depth today to explain to you the final phases of estrone metabolism, how you lab it, how you treat it, when you treat it with food, with just diet lifestyle, when you treat it with supplements, and when you treat it with a prescription. I'm going to explain why you do each one. I'm going to explain the necessity of each one. And I'm hoping to get this all done in one episode. That's my goal. So to the degree I do a good job, like the episode. And to the degree you like the work that I do, please subscribe. And if you know someone that if you know someone that would benefit from what we're doing here today, please share it with them. All right, let's get into the material. I'm going to go that final one. And I want you to know it really goes down to directing the flow of things through a human body. I want to make sure I am doing a good job taking something that naturally belongs in your body and helping escort it through your body and move its way out. The core principle I want you to have with this is that estrogen is not evil. And estrone is just a report on your system load. Labs are just reports as to where things are and where things are going. They're not enemies lists. They're just targets. And they help us understand where there's a block in the system. That's all we're going to be doing today. Where are the blocks? How to move it forward. So we look for the metabolic pressure that's occurring in the woman's body. In a perimenopausal state, if her diet has not been great, following a Western diet, she's going to have some of those metabolic issues. Her insulin's probably be a little bit elevated. She has probably a little bit more body fat, and she'll have a little more inflammation. So that's more the metabolic issue with you're generating too much estrone. Then we'll also have issues with phase 1 liver detoxification. That's when estrone moves into the liver. And we want to understand what direction is it going in there. Is it going to be going in the good direction, 2-hydroxy, or is it going to be in the really not good one, the 4-hydroxy, which is going to be more, mutagenic or generating irregularities with DNA, or more proliferative, which is not good, the 16-alpha-hydroxy. So that's the second thing that we're going to look at for, again, metabolic, to see what you're doing with your estrone, and whether you're generating too much or whether your body's more of a ground to keep hyper producing estrone. Then phase 1 liver detoxification, which direction is it going down of those 3? And then the third thing we're going to look at is phase 2 liver detoxification. That's when you take that active metabolite, the 2-hydroxy, you methylate it, you make the 2-methylhydroxy estrone. And so this is the steps we look to and how we can intervene in each one. Our goal is to normalize the terrain within which we find these hormones so that the hormones can move through the body in its most healthy way. So the first priority with women we want to have when they come in the doors, we want to run just a metabolic panel. We want to understand where they are with metabolism. I'm going to be more focused in their cases with fasting glucose. I'm looking at their fasting insulin. I'm looking at the hemoglobin A1C, C-reactive protein, apolipoprotein B, and we'll also look at the estrone-estradiol ratio in these women. When you get these labs back as a clinician, you want to know, what do you treat when? And I'm a naturopathic medical doctor by training and by choice. I love what I do. I focus always to treat them where they are. Some women need supplements. Yeah. Some women need prescriptions. Yeah. Most women, if not all, need a food interaction. A dietary interaction, excuse me. As a naturopathic medical doctor, we train heavily in understanding lifestyle medicine. So food is always the foundation for treatment. Everybody, no matter what, we want to do a full intake, understanding what they're eating and how their body is absorbing nutrients. A food intervention for this, in cases here, with a patient presents to clinic and they have a mild case, say they have a mild case of irregularity with their estrone being a little bit elevated, we want to do with them more of a metabolic intervention with food. The labs you would see with them, they're glucose, fasting glucose above 95, insulin, fasting above 10. You want to see the hemoglobin A1C if it's above 5.5 or around 5.5. If the C-reactive protein inflammatory marker is around 1, apolipoprotein B, around 90. If the estradiol-estrone ratio is mildly elevated, meaning the estrone is a little bit elevated over estradiol. So if your estradiol is 100 and your estrone is like 120, this is when you're going to use diet. That's your primary intervention in that case. What are the metabolic interventions that I use with food? What am I going to use with all these women with food? Extra virgin olive oil. We're going to do 2 to 3 tablespoons for sure every day in the food that they eat. You'd be surprised how many people don't use extra virgin olive oil. I'm Irish ancestry, but I grew up in a house that was Sicilian. So there's a lot of extra virgin olive oil around the house growing up. And I just took that as just like what life was for us. But that's not very common. Why we do that is because extra virgin olive oil will lower interleukin-6. It also lowers aromatase. So extra virgin olive oil is really important in these women. I'm going to focus on low glycemic carbs as well. It's important that they don't eat carbohydrates that spike their blood sugar. Remember, when it comes back to this, what is this? Estrone. Your body makes estradiol from your ovaries in a normal cycle. And then it goes to your body fat and it can be converted from estradiol to estrone. You can also generate estrone from your body fat de novo, coming from, say, estradiol. You can aromatize it there. You can make estrone. That's why postmenopausal, your body starts making more and more estrone. Thing about estrone is that it creates more insulin resistance in your tissue. It pumps up interleukin 6. It just keeps the cycle going to build more fat. So the more estrone you have, the more body fat you have. We want to do our best to lower the insulin and lower the body fat so that we don't trigger your body making more estrone. We also want to improve the way your body metabolizes estrone out, which I'll get to as phase 1 and phase 2 detox pathways in a minute. But short term, to short circuit the hyperproduction of estrone, we want to make sure that you're careful on what you're consuming carbohydrate wise because of that insulin influence. So we'll go at this by taking a look at their diet. Is there enough fiber in their diet? Are they just eating like, pasta, white rice? And I'm not against eating those things per se, but I am against having them by themselves. If you're just sitting there and just, popping down some rice without enough protein and fat to stabilize it, if you're just doing the carbohydrate without enough fiber in there, that's going to be the problem. Your blood sugar is going to go high. Insulin's going to chase it. Then you have your high insulin issue. Then you're going to create that problem to move forward even worse with that estrone. Another thing we're to promote in this case is going to be anti-inflammatory spices. This is like curcumin. You see, ginger is another good one I like to use. I sit down with the woman in front of me and I kind of understand what's her cuisine. What does she eat? And from that, I kind of tease out the foods that I know that they'll use. If you go in a doctor's office and you don't like curry, and the doctor's going to really push you on curries, and curries are really good for anti-inflammatory. All the ingredients in there can be very helpful for being anti-inflammatory. But if the person doesn't like that, they're not going to eat it. I had that yesterday. She liked a lot of the ingredients that go into curry, but when you put it together, she didn't like it. So I needed to kind of reverse understand her in the room with me. So you want to use spices that are anti-inflammatory, but you want to understand what they will actually eat and then lean in that direction. Ultra-processed food elimination is a big deal. You heard it from me. And ultra-processed foods are foods that have been man-made to taste a certain way in order to manipulate the flavor so that way you'll keep eating it. And these are also considered to be something called hyperpalatable foods is another term we can use here. Anything made in a lab that's generated to make you happy is going to be a problem food. Anything you make in your kitchen yourself is better. There's some off cases, like, if you go in your kitchen, you make yourself a candy bar, which you can do. That's not what I'm talking about. But if you're going in the kitchen and you're making dinner and you're processing that food yourself from start to finish, you're probably in a good place. Ultra processed foods like potato chips, snacks, packaged meals, breakfast cereal, all these things, ultra processed foods, will always be a bad thing for estrone for our patients. So we want to manage that with them. What else we got? When does food not work for that metabolic case? When do I need to change and say, okay, it's not just food? We always keep the food, by the way. Everything I'm going to describe, we always keep them on the food. I always focus on the diet with them. So diet's really important. But when do I need to work on supplements with these people who have a metabolic disorder with high estrone relative to estradiol? They're having high insulin. They're having a little bit of higher hemoglobin A1C. Apolipoprotein B is high. Lipids are a little bit off. What am I going to do for them supplement-wise? So if the glucose is between 95 and 105, insulin's between 10 and 14. If you see the hemoglobin A1C 5.5 crossing over to the pre-diabetic range, so they're getting into like the 5.8. If you see the C-reactive protein still in the normal range, but it's kind of more the higher end of the normal range for the high sensitivity, between 1 and 3, or apolipoprotein B between 90 and 110. And if you see the estrone-estradiol ratio, 1.5 to 2, that's when, and 1.5 to 2 estrone-estradiol ratio would be your estradiol is at 100, your estrone is 150 to 200. This is when supplements are not going to be enough. This is when you're going to step in and this is when food is not enough. This is when you want to use supplements in this case. So the supplements I use here, and this is important, you know this, you go online, people just start dumping supplements on you. There's a time they work. There's the time they don't. But I want you to know when I prescribe them, I run my labs to verify I did something with them. Anytime a doctor just starts dropping supplements at you without a lab, without a history, without context, always question that. I know there's some ethical ones out there that are doing it because they just know what they're doing. That's possible. But be aware that this is a slippery slope where ethics can be questionable. Supplements should be thought of as a medication in my mind because we're doing something with them to help improve your health and your wellness. So I prescribe them. I take this part of the job very, very seriously because it is a part of trusting me as a doctor. So you don't think, I'm not going to give you a supplement and, just trying to make a sale or make something look good on paper. I want the lab and you to match each other. I want you to look good in the labs and feel good in your body. So these are the supplements I use. Omega-3 fatty acids, I like Nordic Naturals Pro Omega. No affiliation with them. That's just a good product. I know it's found all over the place, but I'll do like 1 to 3 capsules of that. That's a really good intervention for women because it's anti-inflammatory. It lowers aromatase. So that could be a very helpful thing. And also, when I use that one and I run my labs, because I also do a lab that tests omega fatty acids status in my patients, I can verify that they're absorbing that omega-3 really well. And Pro Omega from Nordic Naturals, I have really good results with that one. So, just plugging them. And inositol, I'll do 2 to 4 grams. That improves insulin signaling in my patients. So I'll use that as well. Curcumin, going back to that, curcumin it's not just in curry, but it's also I'm making something it's Thanksgiving in a couple days. And I make this chipotle citrus glazed turkey for Thanksgiving. It's freaking amazing. But I put curcumin in that thing. That's cumin. Ground cumin in it. And, it's found in curry, but it's also found in, Southwest cooking and, Latin American cuisine. It's a really good spice, but it's also anti-inflammatory. I'd use that. Curcumin would be 500 to 1,000 milligrams. That reduces interleukin-6 tumor necrosis factor. Resveratrol, 100 to 150 milligrams. That's going to improve insulin and estrogen balance as well. Now I'm starting to get into it. I'm feeling better. When I have a metabolic patient, just I jinx myself. When I have a metabolic patient, and when do I want to prescribe for them? And what do I prescribe for them? When the glucose is above 105, when fasting fasting insulin is above 14, when the hemoglobin A1C is above 5.8, when you see the C-reactive protein, high sensitivity above 3, apolipoprotein B above 110, and you see that estradiol-estrone ratio above 2. So the estradiol, again, 100, estrone 200 or higher. This is what I'm going to be prescribing around these cases. And what do I prescribe? I want you to know I prescribe, these medications are controversial. And I know some people who follow me are very much against all the medicines I'm about to describe. And some of you believe in them deeply. It's always controversial to talk about supplements. It's always controversial to talk about prescriptions. I'm just going to tell you me. I come from my heart when I practice medicine. I come from a space of care and a deep interest in seeing the best done for the person in the room with me. Does that mean that metformin is evil? When I prescribe it? I hope not. I don't believe it is. But I know that there are doctors who see a diabetic patient, just park them on metformin and walk away. That's when it's not a good medicine. So when I prescribe these medicines, it's from here. It's from here. There's a place of care and a place of intellect that I approach it with. And I'm aware of all the controversies around all the medicines I'm about to list. I'm a naturopath. This is what I do. And it's been my population of physicians that have been bringing up the concerns around these medicines since the beginning. So I want you to know I'm aware of the concerns around them, but I'm also very aware of the need to use them sometimes. Again, a scalpel is not my favorite tool, but I use it. I did surgery just yesterday. It is a part of my life. It's not my first favorite thing to do, but when needed, it's what you do. Medications, first one, metformin. In these cases with these women with those labs, I'll do 500 to 2,000 milligrams a day. Divided dose, it has to be done with food. That's going to lower insulin. It's also going to improve or lower aromatase, excuse me. So that's a beneficial medication use. And metformin was sourced originally from French lilac. It was actually an herb originally. So this is not a completely synthetic compound, but it has been derived from a plant. Semaglutide and tirzepatide, this is GLP-1, GLP-2 type medications. These were also originally sourced from nature, from Gila monster saliva. Fun fact on a Tuesday. It's Tuesday or today for me. But these medications, semaglutide, I'll start at 0.25 and work my way up from there. But usually about a 1 milligram a week injection. I'll see that be beneficial. Tirzepatide, I'll start at 2.5 milligrams, migrate up to 10 milligrams as tolerance. But I run labs. I try not to go too far beyond what they need, but I use that to help them get in the right place. I know there are some diehard people out there who are going to say GLP-1s, semaglutide, tirzepatide, these are terrible medicines. And this is, the end. Listen, when a woman is in the room with you and she's doing her best, but her body's not responding, there's harm being done if I don't prescribe these. I could be an arrogant doctor and say, all you get is diet from me, because that's what works. I know it would work, but there's that woman in front of me. I don't prescribe based upon my own opinions of like what's right and wrong. I don't prescribe things based upon what my own experience of things are, because that's a shortfalling for a lot of people. A lot of people whose bodies are very quick to respond to diet. A lot of people who don't have food addiction issues. A lot of people who have, very healthy metabolism. We just change their diet, they get better right away. Sometimes I see physicians whose bodies are like that become very judgmental and unkind to women whose bodies don't respond the same way. Empathy is a trait that should not be lost upon physicians. Physicians truly need to embrace empathy as much as possible. So I'll prescribe these. Low-dose naltrexone, that's a curveball. Low-dose naltrexone. I should do a whole episode on that before. I will. It's on my list. But low-dose naltrexone, just be aware of that. It reduces inflammation and the cytokine load that comes along with that metabolic elevation. Remember, with these people in the metabolic state with that high estrone, they're going to have that high blood sugar. They're going to have that high inflammation. That's their interleukin-6, C-reactive protein, tumor necrosis factor alpha. These inflammatory cytokines, these compounds, we want to lower them. Low-dose naltrexone could be a helpful tool in that case. I know I'll get a lot of questions about what low-dose naltrexone does. So that's my metabolic component. That's when patients come in, I see those labs. I'm thinking about their estrone only at this moment. I'm thinking purely about the inflammation from their bodies, from their diets, from their lifestyle. I'm thinking about their blood sugar. I'm thinking about their insulin. I'm thinking about their triglycerides. I think all these things in my head are running around. And I want to get their estrone levels in serum down. I really need that for them. That's going to help their health. But also think about this. All the stuff I just mentioned, that really is improving your body's health through, changing your metabolism, through lowering inflammation, improving quality of life with diet. And these medications I'm prescribing, not toxic. You know what I mean? So this is a good intervention to start with. So now that we understand that, how to move the metabolic aspect of estrone down and why it's important to move it into the liver, what's the next step? Phase 1 liver detoxification is when estrone gets taken into the liver and liver begins its processing it to eliminate it. Phase 1 is the first one we look at. Phase 1, liver detox, estrone can go in 3 directions: the good, the bad, and the ugly. She was an amazing professor who told me that. I remember her years ago. Anyway, sorry, I just had a little memory there. So what is it? 2-hydroxyestrone is the safest, best way to eliminate estrone out of the body. 2-hydroxy, best. Then you have 4-hydroxy. That's more mutagenic. That's the one that could be more reactive against your DNA. That's the dangerous one, because that's the one that's going to increase that risk for breast cancer. Then you have 16-hydroxy, which is proliferative. So if you have the 4-hydroxy and the 16-alpha hydroxy elevated, you're going to be mutagenic and then proliferative at the same time. This is when breast cancer is a problem. This is why estrone is so associated with this pathology. This is why I want you to understand and internalize this. This is where I want you to see. Unfortunately, these labs, you can't get them done on commercial testing because, as I mentioned at the beginning of the episode, it's women and they don't spend a lot of money on it. Dutch Labs does this, but they do it in a big complex. It's like $700 to $1,000 for the test. I'm not a fan of that. I'm not knocking the precision of their testing, but I am knocking their price points and how slick they are and how they're not making this accessible to women who need it. Because when I'm running these labs, I'm going to run this lab to see where it is. I'm going to give you an intervention. I'm going to rerun the lab a month later. I'm looking at easily $1,500 to $2,000 back-to-back testing. And then I'm going to monitor this every 6 months. If it's off, every 6 months. You want that. We want to make sure we're keeping you in the right track for estrogen metabolism. That adds up. It's offensive. Doctors Data is another lab company out there. Their price point's a little bit more reasonable, around $250. Still, I'm sensitive to this. And I want to remind you, if you went to Life Extension online, just go to lifeextension.com and look up how much they charge for estrone testing, estrone testing, and just look that up, E1 testing, and you'll see it's only $50. That's not bad. I mean, it could be better, of course, but come on, that's not going to kill you. These other testing is. Still, I'm going to explain how they work, when you use them, what levels are important. When they're at one level, just do food, just do diet. When this level, do food and supplements. When at this level, do food, supplements, and prescribing. Got me? Okay. So phase 1 hydroxylation labs, as I mentioned, we're going to look at the 2-hydroxyestrone, 4-hydroxyestrone, and they're going to look at the 16-alpha hydroxyestrone to see whether the liver is pushing in the right direction. When we use foods is when the 2-hydroxyestrone is like maybe low. It's mildly low, about 20% low. That means that you're not pushing it through 2-hydroxy as well as you want to. You want to induce, you want to promote the liver's detox pathway. So that's when food will work well. When the 4-hydroxy estrone is normal, as soon as 4-hydroxy is off, you immediately get active in there. And then the other one is 16-hydroxy. This could be mildly off. That's fine. In that case, we're going to do diet with them, and then with all women, always. You want to do crucifers, the crucifers of vegetables. You want to do 1 to 2 cups a day. That's going to increase your CYP1A2, which is going to help detoxify that estrone. It's going to push the estrone through that pathway. CYP1A2 promotes the 2-hydroxyestrone pathway, moving much more cleanly. So crucifers, really important. That's going to be your broccoli. It's going to be Brussels sprouts. It's going to be cabbage. I don't like kale, personally, but it's in there. So you can do kale. If you like kale, you can eat kale. It's in there. Fiber, you want to do 20 to 30 grams a day. I'm going to tell you not to do supplemental fiber. And I'm really clear on this. If the only way to get fiber into 20 to 30 grams a day is for you to do like psyllium husks, okay, I get it. But I really want you to try doing it with food. I just did a whole series of episodes on making beans. Any food that you eat as a whole food that has a lot of fiber in it is better than buying a supplement at the store. And why I say it is because I get the lowest compliance when people just want to do just the supplement version. So they buy psyllium husks in a powder, they put it in their water, they drink it. Compliance always falls away, always. But if you give them good recipes that they'll eat, you'll get better compliance with using fiber. Protein is 0.8 to 1 gram per pound of ideal body weight. You want to do that because the protein is the thing that builds up your detox substrate. That's going to help your body do the phase 2 pathway. And you're going to start feeding the phase 2 pathway. If you're going to do phase 1 with what I'm mentioning here, with the crucifers and with high fiber, you want to give more protein there to help that detox pathway. Polyphenols, 1 to 2 servings a day, that reduces oxidative redirection. Polyphenols are going to be foods you're going to find in berries. You're going to find them in more plant-based foods. It's an important compound to be consuming at higher levels. So again, polyphenols, more berries. That's always been my go-to with people because I find compliance is high. When blackberries, boysenberries, blueberries, those help well. But what do you do if your patient, doesn't eat berries or can't find good quality berries, things like that? Green tea, high in polyphenols, extra virgin olive oil, That also has polyphenols, as I mentioned earlier. That's great for the metabolic component. Um, so green tea, extra virgin olive oil, dark chocolate, 85% chocolate, which we had a debate in the office. Does anyone really eat the 90% dark chocolate? I don't know. But the 85%, that is really high in polyphenols. We also have herbs, as I mentioned earlier. This would be more like a rosemary, oregano, and thyme. Herbs from Provence, I think, has a high amount of those in there as well, the standards. But rosemary, oregano, and thyme. Red and purple vegetables. That's where your purple cabbage, red onions, beets, purple carrots. I used purple carrots the other day to make lentils. We did a recipe online that discussed that. That's because I want to discuss polyphenols. So you can get polyphenols pretty straightforward, just some simple food changes. Pomegranates is helpful. Apples are good. Grapes are good. Coffee is okay with polyphenols, unsweetened coffee. So that's one of the things we do because that reduces oxidative redirection for phase one for foods. Supplements. When do I jump in with supplements with these people? I use supplements when the 2-hydroxy is 20 to 40% below board. When I know for sure the estrogen's sitting here and it's not being pulled into the liver very effectively. It's not being induced. And so I'm going to use supplements to help push this pathway a little bit harder. If I start seeing the 4-hydroxy mildly elevated, about 20% above board, that's why I'm thinking I'm going to use supplements as well. And same thing with 16-hydroxy. If I see moderate elevation in there, I'm going to stick with my supplements. Still, they're all going to be on the diet, right? We all have on the cruciferous vegetables, polyphenols, fiber. We're really still keeping that pathway running. But I'm going to now add to this supplements. And the supplements we're going to use with these patients, magnesium, 300 to 400 milligrams at night before bed. This is a phase one liver detoxification cofactor. You need magnesium to move phase one, the process. Sulforaphane, which is derived, it's a sulfur donating group. This is from broccoli, from the crucifers, but this is a really concentrated version of it. You can get this from broccoli sprouts. There's a broccoli sprout extract you can get with that. But you do 20, 40 milligrams, and that induces 2-hydroxy detoxification. Diindolylmethane, I'm a big fan of that. I've used that for years. I'll use 100, 200 milligrams to induce phase one detoxification. We use vitamin C. Vitamin C plays a role in several areas of phase one and phase two liver detoxification as an antioxidant, preventing oxidative shifts in the metabolic pathways we want to use. So, I'm going to use vitamin C 500 to 1,000 milligrams if I see that phase one's not being induced into the 2-hydroxy, because that will help keep that pathway running. When do I use medication in this case? This is when it gets scary. When you see that 2-4 ratio, when you see the body's pushing higher towards the 4-hydroxy, and you have less of the 2-hydroxy, the 4 levels going higher and higher and higher, this is when we get more nervous and more concerned about risks for breast cancer. This is when we want to prescribe. We want to be more aggressive. We're to keep them on the diet protocol. We want to make sure they're following that. We want to make sure they're on a good supplement regimen. And then we're going to step in and write some prescriptions for this person, specific to the individual that we have in the room. Metformin is going to reduce insulin. That's also going to make sure there's less aromatase. Again, our goal is to reduce estrone as much as we can moving into this pathway. We're going to use GLP-1s, reducing visceral fat, and that will help lower estrone. You see all I'm able to do here with this so far is just really slowing down estrone production. The pathway is broken, okay? For some reason or other, they're pushing to 4 way more than 2. I know that those supplements will turn the pathway back on. When I'm prescribing around this, my goal with prescribing is to slow down the load, slow down the amount of estrone that's moving into that person. So I do my intervention with these prescriptions with these women with the intent to give less burden on that pathway until the pathway can be, regenerated using diet and lifestyle and supplements. So far, we've talked about the metabolic issue when you're making too much estrone. It's going to be perimenopausal, postmenopausal. Estrone levels are going to be elevated due to your body's moving towards menopause. So your body's more preferentially making estrone, or your body fat levels are a little bit high, or your diet's more inflammatory. There's a lot of reasons why estrone would be elevated through lifestyle that way. We talked about how we can lower it with diet. We talked about how we can lower it with supplements. We talked about when we need to use prescribing. Then we talked about phase one liver detoxification, what that means, how the estrone can go in 3 different directions. what we would do for food, what we would do for supplements, and when we would use medication. Now, the next step with this is towards phase 2. So phase 1, hydroxylation. They take the estrone, they put hydroxy group on it. Phase 2 is we're going to be adding a methyl group onto that. That's the final step. This is the important one too. So we have to see this pathway. So how much is being taken into the liver, what direction it's going, and then how well the liver is able to move it through and get rid of it and process it out. This is very important, the methylation component. Final step. The food works well with the 2 methoxyestrone level. It's maybe 20% below what it should be. But really, you want to look at the methoxy-oxy ratio. And, it should be 1.5 methoxy to 1 hydroxy. So say your 2 hydroxy is 10. This one should be 15. I like it 10 to 10, but 10 to 15 is fine. You want that ratio to look a certain way because that's how your body's processing it through and moving it through evenly. You're trying to find out if the liver is overwhelmed, if it's running too slow. You want to see this pathway as it works. So the thing is that you ratio that hydroxy to methoxy, and if it's really favoring hydroxy, you're in trouble, okay? Because your body's really stuck and you're keeping those reactive metabolites, the hydroxys, in place. We don't want that. We want the methoxy to be a little bit higher in that sense. So methoxy should be higher than the hydroxy. You also want to see if the homocysteine levels between 6 and 10. You can do diet for that. You don't need a prescriber on that. You also see the glutathione. If the glutathione's mildly low, you use diet with that. How do I do diets here? You use alliums. That's the family of foods. And, that's the first thing I think of when I saw alliums. When I think of alliums, I think of garlic, but that's not just it. You get onions and leeks, things of that nature. You want to be using 1/2 to 1 cup a day. Sounds like a lot, and it is. But, if you cook up your onions, it's fine. You can do it that way. Diced onions, saute them. These are sulfur donors. So that's going to help you that phase 2 pathway. Brazil nuts, 1 to 2 nuts a day is enough for selenium. That's an antioxidant that helps promote those pathways as well. Green tea, 1 to 2 cups. That also plays a role in supporting methylation. And finally, hydration, 2 to 3 liters a day. That helps push the conjugates out of the body. If the labs are showing me that the 2 methoxy estrone is low, 2 methoxy levels are low. If I see the body favoring hydroxy higher than methoxy, if I see homocysteine between 10 and 14, if I see a moderate glutathione depletion, it's still in the normal levels, but it's not depleted yet, I'm going to want to hit that with supplements. This is when I want to start getting a little more of a deeper intervention with them. SAMe, 200 milligrams, that's an important supplement to use because it's a methyl donor that plays a role with promoting that phase 2 conjugation. Methyl B complex, that supports COMT doing its job. Glycine at 3 grams, trimethylglycine is another version you can use. That also plays a role with conjugating the amino acids. N-acetylcysteine, I'll do 600 to 1200 milligrams. That also is a glutathione precursor that's helpful. And then if you want to just go straight to glutathione, liposomal glutathione, that's effective at 200 to 500 milligrams. And then based upon labs, following up to make sure those doses work well. Phase 2, when I'm using medications, is when I have deep concern for the woman in front of me. Phase 2 is when I'm getting, at the levels I'm starting to prescribe at, when the labs hit a certain place when I want to prescribe. Actually, no, this is when I'm really applying as much of this up here as possible for the woman in the room with me. This, you would see the 2 methoxy estrone would be 40% below baseline. You would see the methoxy to hydroxy ratio being more 1 to 1. They're about equal to each other. You would see the case where the patient homocysteine is above 14. You would see severe glutathione depletion, really well below the lab values that you should be having. And you would see the 4-hydroxy estrone that's 20% above what it should be. This is what I'm prescribing. This is what I prescribe for these women. Metformin, that improves methylation due to reducing insulin, so that's helpful there. GLP-1s, that reduces metabolic strain, that improves detox pathways. Do you see how ambiguous that is? See how there's no prescriptions that we can use really that are strongly directed specifically to these metabolic pathways? There aren't any. This is just us working as hard as we can to get those metabolic pathways to run cleanly with the diet and the supplement. This is us using prescriptions upstream to slow down that estrone. Honestly, this is all this is, but there's no targeted medication specific to it. This is when I do oncology consult. In many of these cases, we'll go step into an oncology consult because of extreme catechol buildup in the patient. This is the worry that I have, and my goal is to catch it before it hits this point. So the final summary I have here, we start with our patient's metabolic. We fix the aromatase pathway as much as we can and reduce aromatase pressure, which is when the body's converting body fat, it's generating estrone de novo in menopausal, or if they're converting estradiol to estrone, we want to slow that down. So the first step is metabolic. Then phase one, we want to redirect estrogen metabolism, or specifically estrone metabolism. We want to redirect that metabolism safely down the 2-hydroxy pathway. And then phase two, we're going to neutralize those catechols, which is the 2-hydroxy, 4-hydroxy, and 16-alpha hydroxy, and get them moved out of the body. How we do that with these women is in my practice, we follow the lab work. We follow the labs, and we will do diet when it's very mild, supplements when it's a little bit more significant, and prescribing when absolutely necessary. No matter what, anybody who comes in the door with this, we do diet with them. Then, of course, we tier up, as I mentioned, adding into the supplements and the prescribing as needed. You, as the woman, have so much of a emotional vulnerability when it comes to these things. And you are valid to be worried and concerned around these things. And you have absolutely right to be frustrated that the labs that I'm talking about here are not commercially available. They tend to be very overpriced, and they are going to help us understand what your risks are for cancer and whether what we're doing is helping prevent cancer. I know this. Please know that I, in my practice, do everything in my power to work around that in the most respectful way to you as possible. When you're vulnerable and afraid, it's very easy to take advantage of that and offer these, big lab panels, and you're going to spend money, and these extreme supplement packages, and you're going to spend money, because when they put the fear in there, and you already have naturally occurring fear due to family history of breast cancer or any concerns you may have, they're all valid. You're very vulnerable in this space. I hope this helps you be less vulnerable. I hope this gives you empowerment. That's all we're here to do together, because it's not just me. I have a team of people working on this with me. So I hope this helps. Please like, share, and subscribe. And as always, your questions are welcome. I look forward to finding them on Instagram. I do get to YouTube every once in a while. I'm not as frequent with YouTube, but I do get to it. But I do appreciate your input, and I appreciate your feedback. And I'll do my best to keep up with you on Instagram with your comments. All right. With that said, I look forward to seeing you at the next episode. Take care.